Hi there.
Hello.
So today we're going to talk about maternal transmission of Lyme and Bartonella and other tick-borne diseases. We're going to talk about sexual transmission, non-tick transmission, and breastfeeding if you think you have Lyme or you know you have Lyme or other tick-borne disease.
Okay. So I think that the first thing we have to say is that some doctors have strong opinions on this, and I've had other doctors tell my patients that there's no such thing as Lyme hurting a baby, that it's never been proven that Lyme can cause a baby to die, that Lyme can cause a baby to have chronic illness. So it actually has been published. It's been published that unfortunately there have been babies who die from Lyme, and they've done autopsies on the babies and found that the babies have
Widely disseminated Lyme.
Yeah, brain, heart, placenta,
Liver,
adrenals. And some of these babies have had negative Lyme antibody tests. And it's been published even, there was one case where the mom was sick beforehand and the testing, I won't mention, I'm not trying to embarrass the university, but at a major university involved in Lyme research was negative. And then a couple of governmental, agencies tested the sample from the mom and her antibodies are positive. So one negative and ultimately two positive, and the baby was born dead, and there was Lyme everywhere.
Terrible.
So
Well, we know that there have been also miscarriages attributable to Lyme and other tick-borne diseases.
it's a whole spectrum of fetal demise before birth, fetal demise after birth,
People don't
and then no
know.
effect also.
People don't know.
So what happens to the babies that look healthy? Does that mean that if you have a baby that looks healthy, that the baby will be healthy? I mean, some of the syphilis literature unfortunately shows that babies that have syphilis can be born appearing healthy and then develop symptoms as time goes by.
Yep.
So then because syphilis is such a close cousin to Lyme, is it going to parallel in that way? And they haven't really done good studies. There are a lot of very powerful case reports. Obviously, when the babies are born and they died, that's a very and they find Lyme in those babies, that's a very powerful case report. But to look at the outcomes of patients that have Lyme disease and give birth, they've shown and documented adverse outcomes, but in those babies, they haven't done the direct detection tests. It's so important because if you have, cases where babies are born dead with negative Lyme antibodies, but they find Lyme bacteria in them, you can't just go by Lyme antibodies in the babies to show that they're okay. But then they say in these studies, direct detection tests have not been done. Why haven't they been done? What is going on? You're going to design a study that's actually going to show something, you're just going to waste everybody's time.
Right, and the fact that there's so little education and women don't know what to do. So we posted recently a bunch of studies and some comments that you and I made about congenital transmission to try to clear up a lot of confusion out there. And now people are left wondering, what do I do?
What do you do? It's true. What do you do?
What do you do if you're pregnant? And then what if you deliver a healthy baby? Do you breastfeed?
Okay, so if you're pregnant and you have an acute Lyme infection, whether it's a rash or a non-rash acute Lyme infection, you get treated. Some of these doctors that don't take Lyme so seriously will treat for a month. I say if you have an acute Lyme infection, that's one of the instances where I strongly recommend antibiotics throughout the remainder of the pregnancy, and actually probably a little bit after for the mom. Because I've seen at least one bad outcome from a woman who had a acute disseminated Lyme around the time of pregnancy, and I was recommending strongly antibiotics straight through, and she got a few months of antibiotics. She was doing fine. She moved away, and baby was born. She did not continue antibiotics throughout the pregnancy because the new doctors in the area that she moved to told her there's no such thing as chronic Lyme, and Lyme can never hurt the baby. And the baby was born crazy sick, incredibly ill, and remained sick, and then a year later got diagnosed with congenital Lyme.
That's
so
awful.
I do think that is a clear-cut situation in my mind, at least, and then it's less clear-cut for chronic Lyme what to do. I've seen patients that they've elected not to take antibiotics and the babies looked fine. I've seen patients where they didn't take antibiotics and the babies had developmental disorders on the Asperger's type of a spectrum.
Right.
But we don't have good evidence, believe it or not, that the antibiotics help prevent transmission transplacentally.
What do you do in your practice?
I offer patients who are pregnant long-term antibiotics with antibiotics that don't directly affect the baby.
Right.
So things like ceftin and amoxicillin or penicillin derivatives, and they don't directly affect the baby. Things like Zithromax are considered pregnancy safe. But safe is really safer.
Right,
You know,
right.
there's no such thing as a completely safe antibiotic for pregnancy because the antibiotics themselves. What if someone gets allergic to penicillin and they're on amoxicillin?
course.
What if they get C. diff, which is Clostridium difficile colitis?
But
They
you
get
can protect
super
yourself from C.
dehydrated.
diff, can't you, while you're
Yeah,
pregnant?
you can take powerful, you know, probiotics.
I would do that.
So would I.
I mean, if
So would I.
right? I mean, we've talked about this.
I would
you
do
know,
it, but just to
many times.
give both sides of the equation
Yeah.
here, there's not good evidence that it's protective. It makes intuitive sense, you know, if you have an
It's
infection,
logical.
that if you're taking antibiotics, you may protect the baby. But we don't know, does it protect a lot of babies? Does it protect no babies? Does it protect half the babies? They haven't done the good studies that we need to get done.
I understand.
But you and I both, if we were pregnant, would do it, but it doesn't, you know, mean
You
that
happen to
people...
be pregnant right now.
So an announcement, yes, I'm pregnant right now.
Yes, if we were pregnant, we would definitely
yeah.
do it. And also, I would not breastfeed if I delivered a healthy baby because I have Lyme and I have Bartonella. And I think it's reasonable to give formula and not take the risk. What
Right.
do you think?
I agree, actually. So they've isolated the DNA from Lyme from breast milk, and that's been published. And, you know, with other infections, it doesn't always line up where it documents transmissibility. Like for HIV, they can isolate DNA in tears and saliva, but people don't really think that it's spread that way. However, with Lyme, it could be, you know, where the DNA is, the bacteria kind of is also. So the possibility exists, but we don't know for sure. But I always say, like you just said, you know, whole generations were raised on formula. I do think that breast milk in patients that don't have a persistent, possibly transmissible infection would be superior to non-breast milk. But in the case of an infection where you can make your baby sick, if you happen to get through a pregnancy and the cord blood and the placenta and the foreskin, if it's a boy, are all negative, you really want to have that extra risk when you have an option. And, you know, we're kind of on the same page of how, you know, what we do if we have that situation. So yeah, I don't recommend breastfeeding. A lot of my patients have breastfeeded, just even against my recommendation, just so you know. And, you know, it's personal choice, like everything else. As long as the people are armed with the information that they've recovered DNA of Lyme bacteria from breast milk published, then they can make their own decision.
Okay. What about sexual transmission?
So there is some data that seems to point towards sexual transmission for Lyme. And, you know, Ray Stricker did a study where they characterized the DNA of partners of patients with Lyme, and they found Lyme DNA from these people, and the DNA was such that they could type it based on strain. And there's so many strains of Lyme that it'd be incredibly unlikely that people have the exact same strain. And they demonstrated that.
You've treated couples who, right? About
I have. I've also treated couples where one is super sick and the other one is completely fine. And, but, you know, so both Lyme and Bartonella too. I mean, Bartonella, there's not documentation really in humans of sexual transmission. Let me go back to Lyme for a second. There is animal data documenting contact transmission of animals that are in the same cage. Other spirochetes besides syphilis can also be spread by body fluids, like leptospirosis can be spread from urine. And, you know, it's because of the relationship of Lyme to these other spirochetal illnesses that can be spread without vectors. I mean, it has to cross people's minds, but, you know, the CDC says it's not. They have this, like, blanket statement where they say it's not sexually transmissible.
How do they get around the fact that there's so much data that the IDSA has even demonstrated since the 80s?
I don't know.
I read all these studies, like from Alan Steer and Barbara. I mean, these big researchers in Lyme, these pioneering researchers. How do they
You mean
not
about
account
chronic
for-
infection or?
Yeah, about transplacental transmission.
Oh, transplacental is a different story. Yeah. So sexual transmission, those big authors have not talked about that at all. They haven't documented or.
No, I'm sorry. I'm
Yeah.
thinking about our original content, which is about the transplacental.
Yeah. How come they're not sending some alarm, you know, buzzers going about what to do with that? Like, why isn't it a big deal? It should be kind of something that we bring their attention to. People should know about it. You know, it's not something to be swept under the rug. And it's true, a lot of the IDSA authors have published about transplacental transmission back in the day. So in terms of Bartonella, though, so Bartonella is a close cousin to Brucella, and sexual transmission for brucellosis has been documented. So I always think, could Bartonella do the same thing? So in cats, they've even isolated DNA for Bartonella from saliva.
I know.
So
Scary.
you know, again, I'm not making the leap to say that because the DNA of these organisms are in either breast milk or saliva that's definitively transmissible that way.
Right.
I'm just saying somebody needs to investigate it. You know, it's a question that needs to be answered, and the viewers should know what the deal is. And then in terms of non-tick-borne, vector-borne transmission. So people don't know, and I didn't know either until like 6-7 years ago, that Bartonella has been documented to be spread by, you know, not just fleas and lice, which are, you know, the main vectors that they think about, but also, you know, there's been documentation of spread after spider bites. There was one documented case after an ant bite, and there was a case of people that moved into a spider-infested house, and a few of the people kept getting sick with these progressive, weird mystery illnesses, and they traced it to a spider that bit them all. And
I saw Ed Bright short do a presentation on that.
yeah,
It was so shocking.
Yeah, so because you never think that, oh, I'm getting a spider bite, I'm going to treat this spider bite with antibiotics, and maybe we should be changing. I think it too.
I get an ant bite, and I'm like, oh my god,
no,
I'm gonna die.
No, it's heavy on the essential oils in the summertime. I don't.
Permethrin. Treat your clothes, your shoes, your socks.
Permethrin is good for the clothes, but not for the skin.
Right.
On the skin, I put the essential oils.
Right.
I personally don't like to eat that much. There's studies showing the essential oils work just as well if you get these good preparations.
They smell good.
And they smell good. So I'll be smelling like clove and geranium, or just geranium and
citronella.
All those things in the summertime. I don't know. I'm so scared of bugs now. I mean, you know, I used to just be scared of ticks, and now I just don't know what's a safe bug bite anymore. I don't know that we can really know. You know.
I think there's a lot we don't know, and I think there are a lot. I mean, that German study that came out with the mosquitoes carrying Lyme, we don't know. Is it carrying it here? Why would it only be carrying it in Germany?
Again, these ask a lot of questions. You know, they open the door to further research. But the further research isn't being done. You know, It's like these are big topics that need big answers, and we get these little bitty answers saying everything's fine, and it's not satisfactory. Like, where's the data? You know, you can't just say everything is fine. I'm not trying to press panic buttons. I'm just trying to say, look, we need better research. We need more funding. You know, you look at how much funding these illnesses get compared to Zika and HIV and everything.
And cancer.
It's just completely dwarfed by these, you know,
ubiquitous infections. I mean, honestly, many people have these infections that don't even realize.
And most go undiagnosed.
Most go undiagnosed. Right.
Yeah.
So
diagnosed as something else, some label.
That's
what happens.
That's the biggest problem is the autoimmune diagnoses, the kind of like catch-all descriptors, the arthritis, the MS, the various things that are linked. I'm not saying all MS and RA is linked to Lyme and Bartonella, but certainly a lot of cases are. And a lot of those patients ended up getting better on antibiotics.
Do you know that if we can get people to listen, that this can change the paradigm of medical science? I mean,
that's what we're trying to do.
You know what's really going to change?
No.
The drug that we're working on.
Yes.
That's going to really change something.
God willing.
Good.
So we're working on a drug for Bartonella, and we have an amazing team of people working on it with us.
We're working with the best people.
Yeah, and everybody's going to be like, "What's her role? She's not a doctor. I'm the glue.
You're the grease.
You always say I'm the nucleus.
You're the greasy glue.
I like to bring everybody together.
Yeah, you're the enzyme.
I try to get him out of his office.
Yeah.
To try to meet with all these brilliant people and collaborate, and I'm the Dr. Wrangler.
Yeah, the Dr. Wrangler. We'll
Well,
get you a hat.
I've been in the music business a long time. It's like not that much different than working with a lot of artists with different schedules and different personalities, and you're all brilliant, and but we got to get you all in the same room to write the best song ever. And right now it's this drug.
But it's happening. So we're writing a song, and that song is called
Cure Bartonella, or at least come close.
Yeah. So anyway, so that's what we're doing, and so if someone suspects they have Lyme and they're pregnant, what if someone is, thinking about pregnancy, like a planned pregnancy, and has had Lyme before? If these are, where do they go? This is your expertise.
This is my expertise. I'm an expert on something. I would go to an ILADS doctor, International Lyme and Associated Diseases Society. That's what the acronym means. If you go to ilads.org, you can send them a note and tell them where you live, and they can send you back a list of doctors that are experts in treating these zoonotic infections like Lyme and Bartonella and Babesia, etc. And you know, again, my personal choice would be to opt for, risk benefit. All the things that I see with that goes wrong with kids, I would take the antibiotics if it was me personally. I wouldn't breastfeed personally, and that's my opinion.
Mm-hmm.
You know, so
I hear you.
I hope and pray that anybody that's watching this has learned something and got more educated and has seen both sides, learned about both sides. So thank you so much for being with us.
Thank you.